Exercise may be entirely new or even an old enemy for vertical sleeve gastrectomy patients. So it's a little wonder that many want to know whether exercise is even necessary with a tool like the sleeve. The answer is yes, by the way. Most often, though, they want to know what kind of workout to do. And I'm always here to help them and tell you, in my opinion, what is the absolute best exercise for gastric sleeve patients. The answer is whatever you're actually willing to do. And with that in mind, here are some tips to help you settle on a safe and effective regimen. Tip number one, start slowly. You've never set a foot in the gym or exercised up to the day of your gastric sleeve. You'll need to build up to a full-blown workout schedule. Keep that in mind. That must be done once you're fully healed after your sleeve. That's usually between, after 30 days. Before doing anything except walking. So use that time, those 30 days, to work out the discipline in you. Discipline is a sort of muscle, and you need to exercise that discipline. So walk those first 30 days and build that discipline up to that day 30. And after day 30, well, you start building up your routine. Tip number two is discover your passion. And it is possible to be passionate about exercise. Absolutely. And the trick here is to discover a way of moving your body in a way that you enjoy rather than dread. Truthfully, there are plenty of studies that show some forms of working out are more effective toward weight loss than others. For example, strength training versus interval training. But what's most effective doesn't matter if you can't move yourself to do it. So get creative. Think back when you loved doing something as a kid. Maybe you loved to dance or play soccer with friends at recess. Who knows? It may be even hula hooping. Tip number three is set mini goals. You've never run a mile in your life, but you decide that you're suddenly going to run a marathon. Well, you might be setting yourself up for disappointment. I'm not saying you shouldn't dream big. Of course, you should believe in yourself and everything you can achieve in your new and healthier body. But setting smaller goals on your way to big dreams gives you more opportunities to celebrate the progress you're making. And more frequent wins will boost your self-esteem and help you motivate you to keep going. And depending on the type of exercise you're doing, increase the time you spend exercising or the distance you go every week. Before long, all those many accomplishments will add up to an impressive routine. Tip number four is think outside the gym. People love going to the gym, and that's great. But whether you lack the funds for a monthly membership or you're leery about the germ situation during a pandemic, there are plenty of options beyond a traditional gym. Now, free online sites abound these days, and many are geared towards specific interest. For example, yogis can access a range of styles at doyogawithme.com, while sites like fitnessblender.com and Pop Sugar Fitness offer everything from HIIT to strength training. And many customers don't realize that some streaming platforms often include workouts as part of their services. So if you're willing to pay a bit, there are options for you at-home fitness that are nearly endless, from group fitness to personal training, right there in your own living room. We at Endobariatric put a lot of emphasis on your gastric sleeve diet, and of course this is for a good reason, but developing a workout routine that you're excited about is crucial to your long-term success as a gastric sleeve patient. So there you have it. I hope you find this information useful. I'm Dr. Alvarez with Endobariatric.com, where we are changing lives one sleeve at a time. Take care and God bless.